Good afternoon, and welcome to the fifth in a series of 8 webinars being presented by the Patient Safety Authority, dedicated to assisting healthcare professionals improve their knowledge of the investigative process. My name is Rick Andravy, and I, along with Megan Shetterly, will be presenting today's educational webinar on change management, which is part of the Keys to Investigation Keystone project that the Patient Safety Authority is currently conducting. Assisting us today behind the scenes are Shelley Meitzel and Karen McKinnon-Lipset. With regard to our presenters today, Megan is the Patient Safety Advisor for the Northwest region of the state, and I am the Patient Safety Advisor for the Northwest region of the state. Together, we both interact with the healthcare staff to identify safety hazards and reduce patient harm with an emphasis on proactive risk reduction strategies. We welcome any comments or questions, and all materials are provided for your educational use. As you can see from this slide, the Keys to Investigation Keystone project is comprised of 8 monthly webinars and 3 in-person regional workshops. The webinars started in August of 2023 and conclude in March of 2024, while the in-person workshops will be held monthly starting in March of 2024 and concluding in May of 2024, with the ultimate goal of improving system design and, in doing so, improving patient safety through error reduction. The most recent Keystone project roadmap has been posted in the chat box for your review. Now, back to the 4 webinars that have already been conducted to date have reviewed reporting and investigation requirements under MCARE, that is the MCARE Availability and Reduction of Error Act. They've discussed how event reports are gathered, investigated, and shared within healthcare facilities, defined apparent cause, root cause, and common cause analysis, and reviewed when to utilize one of these 3 causal analyses. Also identified were methods to prioritize the investigation of events, and there was a listing of sources of information to be used to identify events. And last was reviewed the specific tools to assist in the conduction of a thorough event investigation. These topics address some very technical resources. So a person might ask, where does change management fit into the picture? So although it is sometimes called the quote-unquote soft side of change, managing the people side of change is often the most challenging and critical component of an organizational transformation that addresses how we perform our duties. Change management is important because it can make the difference between success and failure. Individuals will need to perform their jobs differently, and change management can help with sustaining any gains and making them stick. The degree to which individuals change their behaviors and adopt new processes can have a significant impact on the initiative. With the principles of change management, you can apply a structural approach to the managing of people, the people side of change, and make a big impact on the project's overall success. Creating a new organization, designing new work processes, and implementing new technologies may never achieve their full potential if your staff are not engaged. That is because success depends on how thoroughly individuals in the organization embrace the change. Basically, change management is the application of a structural approach and a set of tools leading to the people side of change to achieve a desired outcome. Ultimately, change management focuses on how to help people engage, adopt, and use change in their day-to-day work. So with that in mind, our objectives for today's presentation are, number 1, discuss the meaning of change and its impact on healthcare. Number 2, apply an 8-step process that will guide your team forward toward a successful achievement and sustainment of your change management plan. And then 3, identify change management resources. It is important to remember that the organizational change happens one person at a time, and ignoring the people side of change can be costly because valued staff leave, and then last, change management increases the likelihood of success. So before we get into the formal portion of our educational webinar today, Megan and I thought it might be interesting to get feedback from our attendees on what one word comes to mind when you think of the word change. And what we would like to do is please have you type your responses in the chat box. And please don't be shy, and you could put more than one word in, but when you think of the word change, what one word comes to mind? If you could start putting your responses in the chat box.
I already see them starting to come in.
Yeah, I see
Constant, challenge, obstacles, action,
hard,
confusion.
I love that one.
Improvement, angst, the 2 words. Hard, reality. So there's a lot of, I think, one says fear. So it's really just interesting. There's a lot of somewhat, I guess, kind of negative descriptors. I think when you're entering into change, it can always be challenging and a little bit fearful. I know myself that I've been involved in, change management. I'm sure you have as well, Rick. And, people are creatures of habit. We don't like change. So I think those negative descriptors sometimes come to mind. Are there any positive ones in there? Oh, progress.
I saw one Meg Hanna put in improvement. So,
all right.
Yeah.
Yeah, so we're going to be talking about these as we go through. Change management itself has a lot to do with the technical component, but there's also that behavioral piece, that adaptive piece, and that's kind of where this comes into play. And that's where we're asking you, what are some descriptors that comes to mind to you? And if you're doing this in a team environment, in your organization, you may want to do this on little sticky notes and have the team write down what are some descriptors of change that'll kind of give you a feel for where you're starting with your team and how they're feeling about change.
Yeah. So we have both negative and positive, and I guess some neutral terms too as well that have been presented to us and everything. Anything else, Megan, in regard to comments regarding the word association?
No,
I
I
know
just think that it's a good exercise. I mean, if you've
that-
not done that before with your team, if you're engaging in a team effort, I think it's kind of good to get a lay of the land, so to say, just to see how your team's feeling and what the feedback that you're getting about it. Because there
Yeah,
are a lot of behavioral components associated with change.
yeah, I guess the thing I, was thinking of, you kind of know what you're up against too. You get a
Yeah.
feel for, what's exactly going on. So I appreciated whoever, was kind enough to put their thoughts in the chat box and all, because I think it really, is important for us to get, feedback about, what your actual thoughts are on, the matter and all. So now, with regard to change, a more formal discussion may include the actual definition of change from Webster, which is to make or become different. Also, in regard to the definition of the psychology of change, it's the science and the art of human behavior as it relates to transformation. And then again, as I indicated previously, change management is a structured approach to transitioning individuals, teams, and organizations from a current state to a desired future state to fulfill or implement a vision or strategy. So, what are the steps of change? So, there are actually several theorists that have their own ideas about what the various steps of change are. But Megan and I are going to focus on John Kotter's 8 Steps of Change, which is part of ARCS, that is the Agency for Healthcare Research and Quality's Team Steps program, which is based, John Kotter's information is based on a book written by him titled Our Iceberg is Melting, and subtitled Changing and Succeeding Under Adverse Conditions. And it's a simple story and an easy read, actually, about a colony of penguins that are about to lose the iceberg they call um, home because it is melting. And contained in the story and characters is a powerful message about the fear of change and how to motivate people to face the future and take action. John Carter has 8 steps. Other theorists have 4, 5, 6 steps. But in looking and researching this, I found that a lot of times uh, the 8 steps are encapsulated in maybe a couple of the steps are encapsulated in one step at another theorist, and also we're going with one that is a little bit more robust in terms of the number of steps that are actually involved. So um, the actual steps that John Carter has identified are creating a sense of urgency, building a guiding team, development of a change vision and strategy, as well as um, understanding and buy-in, and empowering others, creating short-term wins, being relentless, and then ultimately ending with the creation of a new culture. So I'm going to start with step number one, create a sense of urgency. So with regard to creating a sense of urgency, which is step number one, this is where you get everyone's attention and present the need for change by describing the consequences of not changing. You immerse people in data and information about why it is important to change and discuss ways to address the problems people associate with change. So going back to that word association, you see that a lot of times there is a negative connotation and you sort of have to address that, up front. And then I thought it'd be interesting to include information about, well, why do organizations fail in this regard? So they could be allowing too much complacency because objectives are not achieved when complacency levels are high. Um, uh, Creating a sense of urgency fails when you underestimate how hard it is to drive out employees out of their comfort zone. And then creating a sense of urgency is a challenge when there is a lack of visible crisis. And that's where the next step, building a guiding team, comes in terms of identifying the actual problem situation and the process that's going to be followed to address it. So I'm going to turn the discussion over to Megan at this point for her review of step number 2.
Thanks, Rick. Yeah, this is kind of where the real work begins. So when you're engaging in a change management process, you have processes, you have resources that you need. This is all supported by the leadership team, but you need people, right? You have to build that guiding team. This is where the real work starts to begin. But let's first talk about a team. I say there's a team and then there's a team. We're going to talk about like the overarching team in terms of the organizational guiding team. And then I really want to talk to you about kind of more of that local level team, the more, field staff team that's going to be implementing some of the things that you're doing. But let's just talk about the definition of team itself first. So team is 2 or more people. They interact and adapt toward a common goal. So they're not individual goals, they're all working together towards a common goal. They have specific roles and functions. Usually it's a time limited membership and the mission is greater than the goals of the individual members. So, we have sports teams, we have soccer, football, baseball. That's what we think of, I think, first when we think of teams. But in healthcare, obviously we have teams as well. Now, if you've ever taken Team Steps, which is a program offered by AHRQ, the Agency for Healthcare Research and Quality, they talk about healthcare teams and they say that there's basically a core team, which is the team that's providing care to the patient or to the individual in the healthcare environment. And then there's a contingency team. That team is really developed when there's like an emergency situation, say a rapid response team or a code or something like that. And then there's a coordinating team. This is more the team that's overarchingly dealing with day-to-day operations, decision-making, and coordinating throughout the facility. So I would submit, for your consideration that The guiding team characteristics of the overarching facility has these things. They have some key players, usually 4 to 6 members. And for the purposes of today's presentation, because as Rick said, like this is a webinar in a list of webinars, a succession of webinars that are dealing with investigations, keys to investigation. So I'm going to talk to you more about that guiding team that deals with investigations, and really about kind of root cause analysis, because I'm going to talk to you a little bit more about that specific team as an overarching team. But that team understands and can lead the investigation process. They see that process through from beginning to end. It is multidisciplinary. And you should be considering rotating membership to include all services and departments, and include those people that are working on different shifts. You may have to get creative and innovative when you're doing them and how you're doing them. Maybe it may even involve, like, people calling in or conferencing in, but it should be on a rotating basis, giving everybody that opportunity to participate. You should have proven leaders who can drive the change process. These are people who are in strong position power that can offer resources to that team. So for instance, you may have somebody from the C-suite that is involved in that overarching guiding team. They may be ad hoc, they may be there for every meeting, but they're providing those resources, whether human or otherwise, maybe financial, that you need to move the dial on whatever process that you're investigating and trying to correct or mitigate. They should have broad expertise, somebody who has expertise in facilitating that particular process, as well as somebody who has expertise in whatever problem or area that you're looking at, whether it's clinical or otherwise. And then high credibility, somebody who is visible in the organization and is credible. And then someone who has management skills, somebody who can control the process, somebody who's a team leader, a facilitator, helps with the decision-making process, keeping people on target, driving it forward, seeing it from beginning to end. Sometimes yourselves, you may be involved in these processes and people get off topic or they get off target. And so you kind of have to reel them back in. And you may think that that's a good suggestion or get a good thing to talk about, but it's kind of like that parking lot issue. So you have to drive the process forward, keep it moving. Somebody familiar with human factors. So human factors is how we as human beings interact with our environment. So somebody who has some ideas about processes, layouts, system design, with how we interact with our environment. And then somebody from an outside perspective or a fresh look. And I'm going to talk to you about who those people might be on the next slide. So hang on here. So here is the team composition for consideration for your root cause analysis team. So I just wanted to put this out there for you so everybody had this. And this is for consideration. Again, doesn't have to include all these people. If you remember back on the previous slide, I said, 4 to 6 people for your guiding team. So these are kind of roles of those people who might be on the team. And you might have one person who assumes more than one of these. I think there's 11 here roles. So for instance, the team leader may be the patient safety officer or whoever's overseeing patient safety. And by the way, the patient safety officer or the patient safety director might also be the risk manager and the quality director. Because I do see that happen where that's combined into kind of one entity or one role and responsibility. So again, those first two might be one person. The subject matter expert might be that clinical leader or the manager or director of that department. Again, that one person might assume 1 or 2 roles here. I would encourage you to have somebody at the staff level involved and participating in the process, because there's usually that kind of work as imagined and work that's like really happening, or work as done. So you want somebody from the staff level to be participating so they can share what's actually happening on the unit level or in that staff level and give input and feedback. Somebody from senior leadership, again, providing those resources that you might need to move the dial on this process that you're addressing, whether it's human resources or financial resources or other. A patient representative, and not the patient that was involved in the root cause for the root cause analysis for the event that's under investigation. This could be somebody from maybe your PFAC committee, so your patient and family advisory committee, or maybe somebody from your patient safety committee, because I've seen this done even with what we call FEMAs, or failure mode effects analysis, which is more proactive assessment of your processes, but I've seen that done. They bring such a different lens and perspective to what you're reviewing and have some great ideas. Because I think sometimes we're in, the forest so much we can't see the forest for the trees, right? So I think having that outside perspective, maybe an objective person. So if you're looking at something clinical, think about somebody who's from housekeeping or maintenance or infection or information technology or business office if it's clinical. They, again, an objective person, outside view. And then think about students, residents, or trainees. Again, they may bring a different perspective on what they're seeing. They're new to the scene. They may see something a little bit different. And then I would submit for your consideration that you have a separate person that's scribing or being a recorder for the meeting minutes or what's happening during those meetings so you can reflect back on where you're at, where you're going. I've been in those situations before where I've been the team leader. I've been the patient safety, risk manager, and quality person, and also the recorder. Don't spread yourself too thin, right? You want to be effective in your efforts. So make sure that you have a separate recorder, somebody who can take those meeting minutes and help you to coordinate meetings and kind of move the dial. So also think about that local team. I was talking about that before, about that implementation team, because you're going to have somebody on that local level or unit level where you're going to have that implementation happen. And so you need a person who's responsible or championing that lead or that change and monitoring what's happening. And those people that are on that local level need to know what was learned from that overarching guiding team. And perhaps one of those people, and maybe the champion that's championing this lead, was that person that was on that overarching team at that meeting. But you have to tell them what they need to know. How are they going to be made aware? Are you going to have huddles and share that information during shift change or during staff meetings? Or are you going to have focus groups? Or is there some other way that you're going to share that information with them? What are the next steps? What's the layout? What's the blueprint for what's going to happen so that they're not fearful, right? Try to allay those fears so they understand what the next steps are and what the expectations are, and then how that's going to be monitored. And I just want to share this with you. I actually met with a facility not too long ago, and they were sharing with me that they have a program. It's kind of like this clinical ladder program for their staff, where they have staff actually initiating their own programs on a local level, identifying an issue or an opportunity, putting together a team, and trying to move the dial on patient safety and quality. So, just something to consider. But when I saw that, I thought, oh, that's an awesome idea, because on a local level, they have people actually working on these things and being engaged to try to move the dial forward. So with that, I'm going to change gears here, and I am going to switch it over to Rick. He's going to talk about step 3 in this 8-step process: develop a change, vision, and strategy.
Thanks, Megan. And so we've gone over step number 1, creating a sense of urgency, and then step number 2, discussing the guiding team, and they are necessary in this 8-step process, but insufficient conditions for major change. And so, of the remaining elements that are always found in a successful transformation, none is more important than a sensible vision. Vision plays a key role in producing useful change by helping to direct and inspire actions on the part of the majority of staff. Without an appropriate vision, a transformation effort can easily dissolve into a list of confusing, time-consuming projects that go in the wrong direction or go nowhere at all. So we have this development of a change vision and statement. The development of a change vision and strategy focuses on senior leadership, who is responsible for establishing the definition of a culture of safety aligned with the expectations, core values, and shared beliefs of the organization. The communicating of these values as well to the organization's staff, and evaluation of the culture resulting in the translation of these values into expected behaviors, and also establishing trust and accountability while communicating a commitment to shaping the culture. Again, probably one of the more important steps, if not the most important steps, is the actual development of this change vision and strategy. And that will lead us into how that works with getting understanding and buy-in from the staff.
So thanks, Rick. Yep, this understanding and buy-in, this is the stage of making it happen, and it's kind of that tipping point of change. And this is really the rate at which improvement spreads, and it relies, at least in part, on those who are implementing, spreading, and communicating about the change itself. But what stops us? Again, we're going back to some of those words that we were seeing before, loss or losing control, uncertainty, surprise, threatens one's way of doing things. Again, you know, we're creatures of habit. We don't like change as human beings. You know, one of the things that I learned through reading some literature, I don't know if any of you know Peter Pronovost, but patient safety thought leader, anesthesiologist, I think, by background, and he wrote a book a few years ago, and it was called Safe Patients, Smart Hospitals. And in that book, he talks about change and why people fear change. And he said a lot of times, really, it's perceived change, it's not actual change. He said, you know, change happens for a lot of different reasons, but if you were to inherit $60 million, it would likely change your life. Would you say, no, I don't want that because of change? So, you know, sometimes there's this fear of change. We just don't know what's going to happen, and it's almost kind of this perceived notion. So how do we address that change? How do we address that fear that people are having? Well, communication is key. We have to invite open dialogue with people, and we're going to talk about this towards the end of the PowerPoint presentation. But it's about, you know, having leadership communicating with staff about the change, having that bi-directional open dialogue, telling people what you know and what you don't know, right? Being open and honest. Encourage discussion, dissent, disagreement, debate. Keep people talking. Understand the reason for resistance. And one of the resources that's at the end of this PowerPoint presentation is a webinar that was done by Team Steps. It's a really good webinar if you get a chance to listen to that as well. But within there, they talk about this assessment form that they use for understanding people's resistance to change. So as I said before, a lot of times it's just like kind of this perceived thought about, you know, the fear of losing control or loss. But maybe it's because people are afraid that their role and responsibility is going to change, and it's even going to be more than they already have. And how are they going to deal with that? So talking to them about how this is going to look, what their role and responsibility is going to be, and how you're going to manage that so it works for them. It could be that it's implementation of a new design or a new piece of equipment, and they're afraid that they will not know how to use that. So it's beyond their skill set or their knowledge. So maybe allaying their fears and talking to them about the education that you're going to provide and a champion for them to go to, but understanding really what is the reason. Why are they fearing the change to begin with? And then acknowledging their concerns and their perceived losses, and, you know, the anger that they might have, but providing those supportive actions and those supportive resources for those people. I think you just have to keep people talking about it and giving them feedback, and then modeling those expected behaviors. But value those resistors, because, you know, they do clarify the problem and they identify other problems that may need to be resolved first. And their tough questions can really strengthen and improve the change itself. I mean, they may be right. It's a dumb idea. And I can just give you like a really simple example that I've had in my past professional experience. We had a unit that was an outpatient chemotherapy department that I was involved with. And the leadership team or the guiding team wanted to change, again, change management, wanted to change the process for registration for the patients that were coming to get the chemotherapy. And they wanted to do it more centrally at the registration department. However, that registration department was located down the hallway quite a ways from where they were receiving the outpatient chemotherapy. So you can imagine that these patients are coming in, they're kind of already at risk. They get fatigued very easily. So asking them to walk up and down a hallway was quite a lot for them. And then the other component of that change that was kind of like this cascade of problems that developed as a result of that was that the nursing staff who was really responsible for registration before they changed this process was also responsible at that point of registration, which was really quite key, where they were really in communication with the laboratory, with the pharmacy, with imaging, with the physician, the hematologist, and the oncologist, about what was going on with that patient at that particular point in time. And so making decisions about what was going to be ordered, whether they even were going to be seen or not. And so that really impacted their care. And in some situations, there was a delay in care. So, sometimes the idea may not be a good idea to begin with. So think about that. Involve those people up front. So next up is going to be Rick, and he's going to be talking about empowering others.
Yeah, thank you, Megan. Uh, we all know that new initiatives fail when employees feel empowered by huge obstacles in their path, even when they embrace the new vision. Sometimes these obstacles, or the obstacle is uh, part of the organizational structure, such as a narrow job category that undermines efforts to increase productivity. Most significantly, though, of all these obstacles that can occur are the supervisors who refuse to adapt to new circumstances and who make demands on or decisions that are inconsistent with the transformation efforts. So, very important as part of that empowerment process. Take that into consideration. Uh, with regard to empowering others, so what you want to do is provide direction by allowing staff to identify their own team-driven solutions by encouraging everyone to speak up, take risks, and work as a team, as well as sharing the information that you know as the supervisor. Additionally, you also want to encourage learning and introspection along with training of employees to develop the desired skill sets and attitudes. You want to track activities and progress along with setting short-term goals so you can celebrate these short-term wins, which is a nice segue into the next step, which is related to short-term wins.
Thanks, Rick. Yes, so identification of early wins really helps to drive the effort forward. So you want to be able to share those with people early on. Um, but how do you know it's working? So you can institute what's called Plan, Do, Study, Act. Some of you may already be doing this. Um, but plan is, what are you planning to do? And what is it that you want to achieve? And doing it is setting it in motion and studying, what did you learn? And did you meet your measurement goal? And then act is, did it work? But you want to set those short-term goals, because early on, you want that kind of low-hanging fruit to see what's working. If it is working, you want to keep it going. So you initiate those small tests of change. And honestly, when you're instituting something and you want to do it organization wide, you may want to think about like those small tests of change, doing it in a particular department before you move it out to other departments, because you may want to change things, right? You do the plan, do, study, act, kind of test the waters, see what's working, see what's not working. And if it is working, then you can kind of take it to that next step. But it's people power. It's capitalizing on the things that, are going right. And it's working with early adopters. So, there is this thing, it's called the law of diffusion and innovation. And it's kind of like on this bell curve. And you have those people who are the innovators and the early adopters. Those are the people that you really want to address when you're starting to implement something. They say that if you can get and penetrate at least 15 to 18% of those people, that you are going to start to move the dial on implementation of that change management strategy. Those are really the people that you want to get on board first. If you get those people on board, then you will likely start to get what they call those early majority. They're kind of in the middle of the bell curve. Those people want to see that it's working, because if it's working, then they're more likely then to adapt it. And then you have those laggards and those people that are the late majority. And so I think, you're always going to have those people that are kind of those naysayers. But you may be able to get them on board if you can get some of those innovators, early adapters, and the early majority on board. Because if they see it's working, they may change their mind as well, and you can get them to adapt to the change itself. Share the lessons learned, publicize your success early, however you decide to do that, whether it's in data that you're putting out to the unit to show that you're moving the dial, or maybe it's just, you're having a discussion with people when you're doing rounds to share the information that you're learning, what the success is, but provide that positive feedback to your staff. And it could be as simple as a thank you and a smile. People just want to know that they're doing a good job. Recognize and celebrate accomplishments. And again, we have an IM Patient Safety Award that we're doing right now. That's a great way to celebrate and to recognize people for their accomplishments. It could be an individual or it could be a team, but recognize and celebrate those accomplishments. It helps to build momentum. It helps draw in those neutral and, like I said, those reluctant people that are kind of those naysayers. So don't be relentless, or be relentless, just get after that. Don't let up, be relentless. Rick is going to talk about that next.
Yes, be relentless. That's very important. Hopefully, we all realize that the change journey can take years until the change sinks deep down into the organization's culture. New approaches are fragile and subject to regression. After a year or two of hard work, people are tempted to declare victory with the first major performance improvement, and that can be a big mistake. You need to keep that in mind. Typically, problems start early, such as the urgency is not intense enough, or the guiding coalition or the vision are not clear enough. So what you want to do is you don't want to let up. You, again, want to be relentless. You want to acknowledge hard work. Megan just gave a few good examples of that, even something as simple as a smile and a thank you and all. Celebrate successes and accomplishments. Reaffirm the vision. You want to keep circling back to that vision. I pointed out how that step number 3 was so vitally important to the success of any initiative. You want to bring people together towards that vision, and you want to do that again on a sort of continuous loop process, and acknowledge what people have left behind. And then also, you want to develop at this point long-term goals and plans. This point is, hopefully you have enough going on in terms of data and change that you could start moving in that direction of developing more long-term goals and plans. It's very important to have those short-term wins, but you want to start moving the dial to that process that's going to be sustained. Reinforce and reward the new behaviors, and that could be by creating systems and structures that reinforce those new behaviors. And then you want to prepare people for the next change, because it's an ever-changing environment, and you want to stay right on the apex of what is being addressed. So ultimately, what we end up with is hopefully creating a new culture, which is something that I know that I've heard Megan speak about, and it's sort of a passion of hers. So she's going to end the 8-step discussion with creating a new culture.
I am, and thank you, Rick. Yeah. So creating a new culture, and that usually comes last, not first. It's something that you have to foster. It's a journey, and it can be a marathon. It's not a sprint. But again, it's something that you have to foster. And as Rick said before, a lot of people look at that and it's regarded as kind of like, this soft topic. It's not really, tangible. It's more subjective and elusive, and it's, hard to track and measure, but you can track and measure it. We're going to talk about that. But, its effects can be pretty significant. And one of the things I have to say is, if you've ever read the document Free from Harm from the National Patient Safety Foundation, they say culture is not a means to an end, but an end itself. And I think, we need to really think about that in terms of culture. Culture in its definition is shared values and beliefs that influence behaviors of a group of people. Another way of saying it is, it's the way we do things around here. It probably resonates with a lot of you that are listening today, the way we do things around here. So think about that. I mean, when you are actually even doing root cause analyses or investigations, how many times have you found out or unveiled or revealed the way we do things around here? Remember, there's work as imagined and work as done. And how many times have you said, how did I not know that that workaround was happening, or that that was happening on my unit or in this organization? And so, how do you find those things out? Well, it's cultivating a positive safety culture. And to cultivate the culture, you first have to get a lay of the land, right? You have to know what you're dealing with, first of all. So, there is the ARC, or the Agency for Healthcare Research. They have a survey that you can participate in, and it's a culture of safety survey. They actually have these surveys for ambulatory surgery centers. They have them for nursing homes, long-term care facilities. They have them for hospitals. I even think they have them for offices, as well as some other agencies and areas. So it's an opportunity for you to participate in the survey, to look at, like, there's like 10 different composite areas when they're looking at culture. So they're looking at things like teamwork and communication and error reporting, and whether you feel you're being written up or not because you're reporting something, because that can be a negative reflection on your culture if people feel like they're getting written up for that kind of scenario. It could be handoff communication. It could be leadership support for patient safety, management support of patient safety. So there's a lot of different areas. So you kind of have to take a look at that individually with your own organization. I mean, you can see aggregately what's going on across the nation because they have the results out there. And I will tell you, based on those results, the bottom three where there's opportunities appear to be number one, staffing and work pace; number two, handoffs and information exchange; and number three, response to error. But those are, again, aggregate. What's going on in your organization. The top one is teamwork. And I think we've historically seen that teamwork, but then teamwork across boundaries always seems to be a problem between departments. Sometimes we see that. So I would take that survey to see where your opportunities might be within your organization and try to address that. I would also say to you that I would look at the results of those surveys and compare the results of leadership's perception versus the frontline staff's perception, because there might be a gap, there might be a disparity. If that's the case, that's something to look into within your organization. Team Steps itself also has some other surveys that you might be able to use to kind of get the lay of the land, test the waters, see what's going on in your organization. They have an attitudes questionnaire, and they have a perception questionnaire that you might be able to use in order to kind of assess that and see where you're at. But again, this is something that is constant. You're going to constantly foster that positive safety culture. It's not a one and done. People take these surveys usually, I think it's like once every 2 to 3 years. But again, something that you consistently have to foster within your organization. So creating that new culture is developing action steps for stabilizing, reinforcing, and sustaining the change. And it's giving people time to mourn their actual losses, but it's giving them skill and knowledge training. So you may want to think about implementing things like Team Steps or portions of Team Steps program. You may want to think about maybe just culture, crew resource management, or human factors training. So there's so many things, but you don't want to get project fatigue. So you have to identify what you need for your organization, and then develop those reward systems that we were talking about before, and recognize and celebrate those accomplishments, and develop performance measures to continually monitor those results before and after the change, and look for opportunities for improvement, and make those adjustments as you're going along, because you might find that you need to adjust a form. You may need to adjust a process and roles and responsibilities before you move on to the next step, or to spread it to the next department. And encourage people to be open about new challenges, forces, and pressures for the next change. So leadership rounds, I think, is where you can make that dialogue happen and have that interaction with the staff to see how things are going, having that bi-directional communication. and build trust. They say that change actually happens at the speed of trust. And so you as a leader have to have that interaction with the staff, letting them what you know, what you don't know, seeing how things are going. Again, all the things we were talking about before, identifying those opportunities. And I'm going to give you something in the next, I think it's the next slide, to talk about with the staff when you are doing those leadership rounds, like something tangible that you can actually use and introduce into your leadership rounds. This will help you to reveal not only opportunities, but solutions for the problems that you might be seeing or witnessing. Encouraging teamwork from all levels of the organization. How many times have you heard from maybe even somebody who's a housekeeper or a maintenance worker walking down the hallway who sees a risk or an area for concern that has brought that to your attention, right? So encourage teamwork from all levels of the organization, and then support efforts and provide resources as needed. Sometimes, and I'm hearing from facilities, and I know this myself, sometimes you have the Cadillac, you have the Chevy, and then you have the Volkswagen. And maybe those resources aren't there right now for the Cadillac, but maybe you have resources to institute, the Chevy. And I'm just using those as a metaphor, as an example. But I say, don't sacrifice something good for something perfect. If you've got something good and you can implement it, do it. Show concern, provide that feedback. Again, just a smile and a thank you to somebody. And if it's working, tell them that it's working, show them that it's working, and promote that motivation and incentive, recognize and reward. And here's the exercise I was talking about. And actually, there's a link to this in the resources tab. I think it's the next slide after this. But if you're doing leadership rounds, consider asking the staff the things that frustrate them. Say, what's frustrating you? What are some significant problems? We always say, ask them, where's the next event going to happen? Because they're going to tell you, what keeps you up at night? So you want to ask them those questions, but you also want to ask them for their solutions or their ideas. More times than not, they have some really great ideas. They're in it every day. So solutions are ideas that may help to improve quality and safety for the patients. Maybe 3 solutions that they think might be like most impactful for that problem that they're seeing. And then these are the resources. And I think Shelley Meixlow, who is our education specialist, she had sent this out, I think, in the email that you got with all the handouts as well, but these are embedded links. The first 2 are resources. It's a resource list from AHRQ, from the Culture of Safety Surveys. One is particularly for ambulatory surgery centers and one is for hospitals. And it has a really good list of resources in response to like where your opportunities are with those like composite scores for the surveys. There's a leadership rounding guide, which might be helpful to you. Also, it's kind of this blueprint for how to do leadership rounding. There's the magic wand exercise, which I was just showing you in the previous slide. There's some root cause analysis specific resources for you, RCA Squared, which came out a few years ago from NPSF, which is now kind of merged with IHI, the Institute for Healthcare Improvement. And then we have our own RCA tools from our website on Patient Safety Authority. Team Steps 3.0 is also there if you're interested in that program. And this is the webinar, the second to last bullet point, using team steps to create change at the organizational, team, and individual level. Really good webinar. Invite you to listen to that. I think they did it in about 2017, just a couple years ago, but some really great tips and tools. And then here's a worksheet, the last one on PDSA for cycle planning, if you're not familiar with that. Okay, so this actually concludes our slide presentation portion of the program, and we would like to begin our question and answer period. I think we have a few minutes here left. I'm not seeing any questions come in. Rick, are you?
No, I'm not seeing any. Maybe we could take some advantage of some of the time that we have remaining and promote our workshops in the spring that we're holding, especially the one on implementation, evaluation, and measurement. I think it was going to have a lot of information pertinent to what we're talking about today. And of course we have those same topics addressed as webinar January, February, and March. But I think the workshops give a great opportunity for individuals to actually apply a lot of the concepts and principles that we talk about throughout this whole webinar series, but in particular today's, in terms of sustaining the gain and its focus and how you can go about doing it is I think, vitally important. We don't have, as a healthcare industry, we don't have a lot of time to waste, so we want to make our efforts, sustainable so that we're not constantly going back and reinventing the wheel.
Agreed. And one of the other things I have to say is, and I forgot to mention this earlier, was I think so many times, we look at how things go wrong. We're talking about investigation. Obviously, we want to fix it so it doesn't happen again. But how many percent of the time do things go right? There's kind of that safety one thought process about doing root cause analysis and investigating things. But you can apply what goes right to see, where your efforts are that are working, right? So if something's going right, congratulate those people, look at that, capitalize on that. So think about kind of that safety two portion of things as well, because a lot of times, in healthcare, we're doing things right. Congratulate people for the good work that they're doing and capitalize on that. And one of the other things too is feedback. Just talking about giving information back to people about what's going on in the organization. And we did a webinar. I'm just going to give a shout out. Andy Moyer did a webinar for us last year from Hershey Medical Center, and he was talking about that feedback loop. It doesn't just go to a black hole. I think that was the title of it, and it's on our YouTube channel. He also had some really great suggestions and recommendations for culture change and how they handled their feedback loop to their staff with regards to change management and encouraging people to, report events, that they don't go to a black hole, and the changes that are happening within the organization as a result of investigating and addressing those issues so that people know something's being done about it. Like I said, if something's being done about it and people know that, they're more likely to continue with their efforts.
Yeah. Well, and that was a pretty detailed program that they developed, and quite impressive, to be honest. But actually, when you were talking, Megan, when we were talking about leadership rounds, it's even just, circling back to those individuals that provided input and insight, during, leadership rounds. And I remember visiting one of my facilities and participating in their leadership rounds and seeing that actually in action, and the response of the actual, employees that are out there on the front line. And, a lot of times, when you see a group of senior leaders walking around the facility, people run the other way. But in this case, the staff had a good level of engagement and follow up that the leadership was able to provide over time. And so they look forward to, this rounding process where it gave them the opportunity to provide input and insight into their concerns as, employees. So you can run the full gamut. So I'm glad you brought that up, Megan, because that's a very important aspect of what we're talking about.
I think if anybody's even doing, any kind of change management work, and introducing team steps or any of the supportive, programs that I was talking about before, I can't emphasize enough. I think, if you do some of these simulation activities, it helps people to see the other side of things so that there's not fear, that kind of loss of control. One of the things that I was involved with, I actually went to a program for Lean Six Sigma, which is basically, trying to reduce waste, maximize value, improve quality and safety within organizations, and kind of, reduce variability. But they had us building, it was a simulation activity. We were building cars with Legos. I don't know if any of you've ever participated in anything like that. But anyway, it was interesting because they put us in groups of like 6 or teams of 6. And there was like 6 groups of these teams of 6. And it was a time limited situation where they gave you like, I don't know, 3 minutes to kind of build these cars with Legos. And my team was always last. Like we never got, we never won. And you know, the reason we didn't win was because we weren't set up right. Like we really weren't like streamlined to make the process work. And it was where we were sitting at the table. And it was funny because we would debrief afterwards to say like, well, like, where are we messing up that we're always losing? We're never winning here. And what we found is we had to move our seats at the table and none of us wanted to move because all of those things we were comfortable where we were at and we were uncomfortable with moving, you know, and we didn't want to get up. We were kind of those creatures of habit. We were comfortable, we didn't want to move, but guess what? When we moved, we started to win. So, you know, I mean, as simple as that was a learning experience that change management can work for you. So just think about those things, those simple things that you can introduce into some of the work that you're doing to get people to see the other side of it.
Yeah. Megan, I did see something pop up, and it was by Dr. Torres, and she said that she couldn't see the link. So I don't know if you're able to back up a slide or two where you have your list that you were going over. I think this is what you were talking about. I mean,
Yep.
you know, the links, obviously, and they're the interactive links. So it's what, slide 35 of the slide deck.
If you experience any issues accessing the evaluation or the certificate of continuing education, please feel free to direct any inquiries to Shelley Meixel, and her email is here. It's shmixell@pa.gov. And that concludes our webinar for today. Thank you everyone for joining us.